Okay, today we're going to talk about pain assessment, okay? This is my patient. She's over 65 and she's here for follow-up for gallbladder surgery. So things you always want to take into consideration is that pain is subjective. Just because the nurse can't see it doesn't mean that it isn't there. You also want to take into consideration gender, age, and culture because these things can factor into how a person both perceives and expresses pain. Specifically with age, different disease processes will affect different age groups. So you want to be mindful of things like in this age group, osteoporosis, arthritis, chronic constipation. You want to make sure you want to look at all those things. Okay, so let's begin. Hi, so you're here for post-op, right?
Yes.
Okay, great. So do you have any pain today?
I have some pain, yes.
Okay, where is it located?
Right here.
Okay. When did it start?
With the surgery.
Okay. Has it gotten worse or better?
A little worse today.
Okay. What does it feel like? Is it sharp? Is it throbbing? Is it an ache?
It's more of a dull kind of pain.
Sort of persistent.
Mm-hmm.
Okay. I'm going to ask you to scale your pain for me, okay? People in this age group have a difficult time doing the number scale. They find it a little bit abstract, so I'm going to use the descriptor scale. Would you say you have no pain, mild pain, moderate pain, or severe pain?
I would say it's moderate.
Okay. Does anything make it better, and does anything make it worse?
It does seem to feel better if I'm laying down, particularly a bed, a couch, something like that.
Okay, and what about worse?
Getting up, doing activities.
Okay, and is it affecting your daily life? Are you still able to clean and shower and do all that stuff?
Not as much right now.
Okay. How do you look when you're in pain? How would people around you know that you're in pain?
I don't think they would. I try to hold it in a little bit.
Okay. And why do you think you have this pain?
From surgery.
Okay. While this seems like a weird question to ask, it's actually important because that would be kind of a more typical response, but you may end up getting responses like, God is punishing me. Asking this kind of question gives you insight into the patient's kind of perception and helps you treat them more specifically. Okay, well, while you're here, I've noticed that you've kind of been rubbing at your hands. Are you experiencing pain in your hands?
Yes, I do. In my knuckles.
Okay. Has it been for a while?
Yes, long time.
Okay. Even though she's here for one thing, as a nurse, it's always good to assess the whole patient. And now that I've noticed this, I can help her with this too. What she's describing over 6 months is chronic pain. Okay, well, at this time, I'm going to do a pain assessment, okay?
Okay.
So I'm going to be measuring her knuckles. I'm noticing swelling, redness, abnormality in shape. She's reporting pain. So you can also take the time to measure other joints, because if it is arthritis, then it would probably, the likelihood of it affecting other areas is high. At this time, you can also take a look at muscles and skin, okay? So you're looking for bruises, maybe from injury, wounds. They could be pressure ulcers, things left untreated. You want to look at hair distribution. If it's uneven, it can be kind of a sign of peripheral vascular problems. So all these things cause pain. You can test sensation by breaking your tongue depressor in half. You can use the dull side. Close your eyes and tell me if you feel dull or sharp.
Sharp.
Okay.
Dull.
And you can do this
Dull.
on all the
Sharp.
limbs. Okay. And last but not least, we're going to assess the abdomen. Okay, lay down for me. Okay, so you want to look at the abdomen and make sure that everything looks symmetrical and even. And when you palpate, you're looking at the patient's face, looking for grimacing or guarding. These are nonverbal cues that the patient's in pain. At the same time, you just want to make sure there's no bulging. Okay, you can sit up for me. And last but not least, you can use things at this time like a pain brief inventory. It's a worksheet I prefer it because it gives the nurse an opportunity to kind of assess really how badly the pain is affecting someone's life. It takes a look at mood, walking ability, normal work, sleep, and enjoyment. Because chronic pain can really kind of change your life. It can lead to depression, malnutrition, and disrupted sleep patterns. So, thank you.